I'm Dr. Prakash, nephrologist at Manipal Hospital in Malleshwaram for the last 2 decades or so. And we have seen a sea of change in this Malleshwaram hospital right from the time I have started working almost 2 decades ago. To be precise, I think I started in 1998. And then we have seen a lot of changes in meaning that this started as a nursing home kind of a thing, and then now we see this place developing as a big hospital, secondary care hospital, wherein we can say that this is the center wherein a lot of people have had enough treatment and they're quite happy with the setup and the multidisciplinary departments what we have here. I'm really proud to be associated with Manipal Hospital for a long time now. And then not only this, in addition to working here, I also work at Manipal Hospital, main hospital or Old Airport Road, wherein I'm a DNB faculty. We have PG courses there for the DNB nephrology. So we have been doing that. Coming to the department, what I run here in the Malleshwaram Hospital, we have state-of-the-art department wherein we have almost 12 to 14 stations, dialysis stations, with all the stations manned by good number of technicians, nurses, and also the doctors. One unique thing about this place is that the patients are being dialyzed sitting on the chair than lying down like real patients. So that is a major difference what our patients feel, and we also feel comfortable treating these patients sitting on the chair, trying to be as normal as possible, trying to do their routine things on the chair. So that is the difference what we have found from the rest of the center. Kidney disease, as you all know, is a real bad disease to have, and especially so when somebody has chronic kidney disease, we call it as a real pain, which is a devastating illness in the family. And unfortunately, we get to see around 2 lakh patients, new patients with end stage kidney disease, what we call it as. And out of the 2 lakh people who end up in end stage kidney failure, unfortunately only 5 to 10% of them are able to get some sort of a treatment in the form of dialysis or transplantation. And as you all know, in India it's very difficult to afford to get this treatment done. So my appeal would be to prevent this disease in the country, all over in the world. But specifically, if I have to really say about kidney disease, is that people who have these chronic diseases or reversible disease in the form of diabetes mellitus or hypertension should get themselves screened for kidney disease and do something about controlling this disease. And when I'm talking about prevention, I think prevention is very important. It's what everybody says, but what is that we need to do is very important. So with regards to kidney, I think probably they need to definitely have healthy habits, healthy eating, healthy drinking meaning in the form of liquids, in the form of water, not the beverages, alcoholic beverages to be specific, and then to keep themselves healthy and fit. I would also advise them to have regular exercises, at least half an hour to 45 minutes, 5 days in a week. And then the problem now is about obesity. Obesity is really raising in leaps and bounds, and obesity relates to a lot of diseases which can be part and parcel of the obesity complex. So trying to do a lot of things to get their weight down is very important, as we all know that it is the disease, or it cannot be called as a disease, but it is a form of structure what people develop, and then that causes a lot of havoc on the body. So it is very important for us to do something about obesity by trying to eat healthy diets, avoid unnecessary junk foods, do exercises, avoid sitting for a long time, avoid sedentary habits, take less of salt, less of calories, less of sugary diet to keep themselves empty. The ultimate point I would like to make here is that, as I said, prevention should be the mantra for times to come. One should get into these couple of things like the 5 S's, what we call it as restriction on salt, sugary diet, avoiding sedentary habits, stress and to cut down on the stress and strain, and be happy always, and things will just start moving in the right direction. A word of caution for the general public is about usage of drugs which are available over the counter, especially the drugs like painkillers, or what we call it as non-steroidal anti-inflammatory drugs. This is one of the causes for kidney disease. So my appeal would be to avoid taking or going to the pharmacy and trying to fetch drugs to kill their pain or whatever. So that is one of the most important thing what the general public should know. It is always better to consult the doctor and then take a medicine than trying to go to the pharma retailer and fetch drugs, which can cause a lot of problems, and many times it is irreversible. So this is a very, very preventable thing which we need to keep in mind. This year, incidentally, Malleshwaram completes 25 years of successful years from the time where they started way back in 1991. We are all very grateful to the Manipal group of hospitals who have been very, very generous, always helping in nature. It has been a great movement for all of us at Malleshwaram Manipal Hospital for having completed successfully 25 years of existence in this area. Malleshwaram is an area wherein a lot of centers have come up in the last 20-25 years. We have seen a sea of change at Malleshwaram Manipal Hospital from what it was then and what it is now, in the sense that it used to be called as a nursing home, but now it has developed into a full-fledged hospital with multidisciplinary departments. And I'm also very fortunate to tell you that I have been working for the last 20 years or so at Malleshwaram, and we have a full-fledged ICU unit with intensivists round the clock, full-fledged emergency service along with radiology, other super specialty departments which are doing wonderful work in the last couple of years. And it has been a real privilege to be working in this Manipal group of hospitals in Malleshwaram. I would wish the Manipal Hospital very happy Silver Jubilee celebration, and look forward to be working for times to come in this place. Thank you.